I'm Peter, and today I'm going to share with you a famous phobia called claustrophobia. And first, I'm going to give a brief introduction about the phobia and the symptoms of it. And most importantly, I want to introduce the treatment and the cures for the disease. And finally, I would like to share some additional information about it to make you more understand about the phobia. Okay, let's begin with the first part. What is claustrophobia? Have you ever experienced that when being in a confined, small place, such as an elevator, a classroom, or even in a car, and you feel uncomfortable and anxious? If yes, then you might be suffering from claustrophobia. And what's the cause for claustrophobia? Research indicates that past experience has a lot to do with the disease. If your parents or your friends are suffering from claustrophobia, and once you see them having panic attack in a certain situation, then you are very likely to be affected by them. And another reason for claustrophobia is a relatively smaller amygdala. Amygdala is a organ to help control emotions. Without a normal size of amygdala, we are more likely to feel anxious. And claustrophobia is actually a very common phobia. According to research, 3 to 7% of people suffer from claustrophobia. And what's more, in the UK, about 10% of people have this disease. And is claustrophobia really that scary? What's the symptoms of it? When claustrophobia attacks, dyspnea is the most common symptoms, which means you may have difficulty breathing, and you will also feel your chest is tight and accompanied by sweating and panicking. And aside from those physical conditions, there are more complications of claustrophobia. People suffering from claustrophobia are very hard to socialize normally. They are not likely to have a decent quality of life. And what's worse, they have to be aware of everything that might cause danger because of the phobia. Even driving a car might be life-threatening for them. And after understanding the seriousness of claustrophobia, what can we do to deal with the disease? There are 4 major treatments for it. First, medical cure, the most convenient and efficient way. Anxiolytics helps ease the anxiety. And the second one is called cognitive behavioral therapy. This is mainly adopted by most psychologists, focusing on the patient's thought and help them to overcome the psychological problem. Third, this one is called the systematic desensitization. This one is a relatively new method to treat the phobia. By progressively getting used to the anxiety level, patients can gradually face the disease, and as time went by, they will be able to deal with the fear. And the last one, it's also the easiest way for most people to do, is by exercising. Running and yoga can help activate blood circulation, and exercising also boosts our brain's secret endorphin, a chemical that makes us happy. These treatments are proven to be beneficial to the phobia. If you or your friends are suffering from the disease, these ways can definitely help you. And now I'm gonna show you another phobia called agoraphobia. It's quite the opposite to claustrophobia. People with this phobia are afraid of crowds and open space such as a plaza or a park filled with people. And the symptoms of agoraphobia is almost the same as claustrophobia. And interestingly, the two total different phobia might happen simultaneously. Imagine a small and confined space full of people. It would be a nightmare for the one who got both disease. And this is the end of my presentation. Thank you for listening.